Actress Anne Hathaway recently opened up about her painful struggles to get pregnant. So how common is infertility and what causes it? Dr. Lisa Hansard from Texas Fertility Center is here to talk a little bit about this. And, first, let's chat a little bit about the significance of Anne Hathaway sharing this information about herself.
Well, first of all, it's awesome that she's come out and been so open about it because she's a very well-respected actress, and to show this degree of vulnerability and transparency is really unusual coming out of Hollywood. I mean, way too often we see pregnancies portrayed as easy to obtain and glamorized so that we think women can get pregnant at any age. It's not true. 1 in 7 or 8 of all couples are going to suffer from infertility.
And so, the other thing is she's pretty young. And so people sometimes think, I remember when Beyonce came out and discussed the fact that she had had a miscarriage. People don't typically think that these things happen to younger women.
Right. Well, she's actually, Anne Hathaway is in her mid-30s, and this was her second pregnancy, and that's the truth of when we start to see fertility decline. Too many people think I'm good until I'm 40 or 41 because I see all these celebrities having twins at 45, so if they can do it, I can do it too. And the reality is what happened with Anne Hathaway is what happens to the majority of women in their mid-30s when fertility starts to be affected.
And so what types of things, when we talk about women in their mid-30s trying to get pregnant, what are some of the issues that cause infertility?
Really the most common thing is going to be aging eggs, and the fact that the older we get, the higher the chances of having a miscarriage and the longer it takes to get pregnant. So the most important thing about this is just starting the conversation, whether it's with your OBGYN, if it's with your friends, you get to understand that, hey, I'm not alone in this. So many people won't talk about it because they feel that they're isolated, they're embarrassed, they feel inadequate. But when you open the conversation up, all of a sudden, people come out of the woodworks and you see how common this is.
Right. When we think about couples who are trying to get pregnant, at what point, what's the number for if you've been trying for X amount of time, hey, you probably want to go chat with your doctor about something because it could be something more serious?
So first of all, it's unprotected intercourse, not we've really been trying, but whatever length of time you haven't used contraception. So if you've gone 6 months without using contraception and you're over 35, it's time to get tested. If you're under 35, we spread that out to a year of unprotected intercourse.
And what does getting tested, what does that look like when you talk about getting tested? What type of tests are done on women?
Super simple things. We look at ovarian reserve. We make sure that the anatomy is normal with open fallopian tubes and a normal uterine cavity. And then we check a sperm count on the male. So these things are really pretty easy. Some blood work to test hormones. And a lot of it is just reassurance that you're on the right track. But sometimes we see a problem that's super simple to address and fix.
Yeah, and the point is not to get discouraged, right, when you're going through all of this.
So many people think if they come to see someone like me, all of a sudden they're going to have to do in vitro fertilization. So many easy things that we can do short of that.
Right. It doesn't always have to go that far.
Absolutely not. Sometimes, I'm in scrubs. I just got out of the operating room this morning. Sometimes a quick little surgical procedure is enough to bridge that gap and make things happen if there was a minor problem.
All right. Dr. Hansard, we thank you so much for stopping by and telling us all this good information. If you guys missed any of this, this interview is going to be uploaded onto KVUE.com right after the show. We'll be right back.